My first audience would be medical students who have a working knowledge of medical terminology or jargon. These would probably be nursing students or doctoral students, and it would probably be in the form of some kind of case study or a presentation for this specific type of disorder. Today I want to speak to you about hypertrophic cardiomyopathy. It is an autosomal dominant disorder associated with increased morbidity and premature mortality. It is traditionally diagnosed on the basis of increased cardiac mass with histopathological findings of myocyte enlargement, myocyte disarray, and cardiac fibrosis. However, given the availability of sophisticated non-invasive imaging techniques and echocardiographic demonstration of unexplained left ventricular hypertrophy constitutes the current basis for a diagnosis of hypertrophic cardiomyopathy. Echocardiography has shown that there is considerable diversity in the manifestations of hypertrophic cardiomyopathy, including variable age at onset from early childhood to late adulthood, and severity of left ventricular hypertrophy. Left ventricular wall thickness in hypertrophic cardiomyopathy can vary from slightly above normal to more than 50 millimeters. And massive hypertrophy is increasingly recognized as an important risk factor for sudden death. Hypertrophic cardiomyopathy will often result in a cardiac event such as a myocardial infarction. Myocardial infarction will often result in the demise of the affected person. Research shows that stepwise therapy can reduce high blood pressure in patients with hypertrophic cardiomyopathy. In a study of 115 hypertrophic cardiomyopathy patients, including 94 with obstructive hypertrophic cardiomyopathy, stepwise antihypertensive therapy effectively controlled both obstructive hypertrophic cardiomyopathy symptoms and hypertension. My next audience would be for the layman, or someone who has the disorder but doesn't know very much about it, or a family member who wants information on it. I translated my previous speech into a language that everyone can understand. Hypertrophic cardiomyopathy is a genetic disorder. This simply means an enlargement of the musculature of the heart. This disorder is associated with an increased morbidity rate, which means that the likelihood of death is high. It is also associated with a high rate of premature mortality, which means that the affected person is more likely to die at a younger age than average. It's usually caused by the muscle tissue in the heart being enlarged or the tissue of the cells being aligned improperly. It can also be the result of cardiac fibrosis, which is characterized by little cysts called fibroids that are actually in the tissue of the heart. With the tools that we have available to us, such as the echocardiograph, we can diagnose this disorder much easier. When we use this technique, we have seen that this disorder does not affect any specific demographic. It can be found in people of various ages, from childhood all the way through to late adulthood. The thickness of the left side of the wall of the heart is the most commonly affected area, and it can range from slightly enlarged to more than 4 times its normal size. The more severe cases are being increasingly recognized as a dangerous problem, which can result in a heart attack, cardiac arrest, and sudden death. A study was done which consisted of 115 patients that suffered from the disorder. This included 94 patients who had the obstructive form of the disorder. The obstructive form of this disorder causes a decrease in blood flow, but an increase in blood pressure. The treatment that was used to treat this were antihypertensive drugs or blood pressure medications. These medications are very effective in controlling this disorder.